So I think we have the most fun topic, the Techlash. And we've got a perfect panel for this as well. We've got representatives here from Verily, from Google, and also from the physician world. Yeah. So I just wanted to kick things off with just a quick show of hands. So who here trusts tech companies with their health information, just in general? Okay, I can see about 10 people have their hands raised. And who would never want a tech company, say a Google or an Amazon or an Apple, to have access to their health information? So I guess we have about as many in both camps, which means a lot of people here are undecided. So there's some converts. Yes. that could be won over in the audience. And I guess we'll kick things off by just talking about this idea of, consumer comfort. And it seems like from just this straw poll that there are certainly people here that do not trust tech companies at all with their health information. Do you think that that is more perception, or is there something very legitimate about that fear? And I'll kick things off with you, Dr. Califf.
I think it's legitimate in that, when you talk about preferences, it's all a matter of perception. That's what preferences are based on. So from that perspective, it's legitimate. But we're certainly finding if you go one level deeper and you actually engage with people, and particularly if you engage with people and their clinicians at the same time, the vast majority of people are happy to have their data used if they understand what you're doing with it and why it's being used. And I'll just to kick it off, I'll also say people are not aware of how hard it is for their own clinicians to get access to their data, the way electronic health records are configured. So what I hear out there, and I'm half-time at Duke University Health System, so I'm part of this, is tremendous frustration for lack of access to information that would help you with your health.
It is possible, though, to empower access, which is important, while promoting privacy and transparency. And there was a recent Black Book survey that showed that 90% of patients are unwilling to share comprehensively all of their data with their physicians. That's a problem. And as that trust starts to erode over time, it's concerning when we think about what's happening with sharing of healthcare data, particularly outside of the healthcare ecosystem where there are no HIPAA protections. As I think that show of hands that was sort of modest, because I think people were still waking up, showed, not everybody is willing to trust the marketplace to ensure that those privacy protections are adequate.
Right. I would just add, going back to your original point about trusting tech organizations, I think it's really a matter of perception. It's not about only about trusting, it's also about understanding, and that's what hopefully we'll talk about a little bit more today, is understanding actually what is going to be done with that information. And so I think creating a little more education and transparency around that will certainly help guide that conversation.
So I want to get back to this issue that you brought up about privacy and weighing that versus access to information. So just from where I sit, I often see HIPAA be blamed for everything. In the startup world, it's like if your app doesn't have a good user experience, then it must be HIPAA's fault. But I do think it's a fair point that HIPAA was created at a time when the Apple Watch, the Fitbit, didn't exist. So as these new tools have hit the marketplace, should we be thinking about revamping the rules and regulations that govern kind of how health information is shared?
I think we need a patient-centered privacy framework that's understandable and transparent. We do not have that today, and there's a lot of activity in Washington around federal rules for data sharing and data privacy that fall short, and the AMA is concerned about that. We've made our voice, I think, loud and clear on the issue. You have to remember, not all data is covered by HIPAA. Let me repeat that. Not all health data is covered by HIPAA. Once data is shared by patients with an app, HIPAA often does not apply. And what we have to remember is that app developers, data brokers, potentially have relatively free rein to do with that data what they wish. That could be for gain for the patient. It could be gain for the company, for commercial gain. And while I want to see my patients have access to their data, and the AMA strongly supports that, we have to make sure that it's done in an appropriate way. What patients may not realize is that we're creating a situation where their genetic reproductive, substance use disorder data, financial data, may not just be used to support health, but potentially to limit access to health, to limit access to life insurance, or even be disclosed to their employer. And those are things that we are very worried about, and we think we have to get right as this space expands.
Yeah, I mean, I would just say it's a two-edged sword that we have to recognize and understand better, because it's not just, you know, what has been thought of as health data under HIPAA. For many people, it's not the most important data related to health. Your habits of everyday life are actually the main determinants of health: where you live, whether you exercise, what you eat. And you know, that information is not covered under HIPAA. So on the other hand, you know, we live in a country that's just experiencing its 5th consecutive year of a decline in life expectancy. And that is not because of lack of access to very fine-tuned genetic data. It's because of the way people are living. The problems are addiction, suicide, cardiometabolic disease are both, or all 3 of those are increasing now in this country. So if you really want to improve the health of the population and individuals in it, it's got to be more than the information that the doctor currently deals with. And so, you know, how to navigate that in an appropriate way, I think, is a big issue for all of us to deal with.
And I wouldn't disagree with that. We need a patient-centered framework that the patient's in control of how it's being shared, who's getting it. Does everything need to go out the door, or just pieces of it? The idea of data minimization, where only the information that's relevant is shared and only kept for as long as is needed, I think are important issues that, frankly, there just is not a framework today that we're seeing developed in the marketplace.
Well, but Jesse, let's delve into that a little bit. You're a practicing doctor also.
Usually on Tuesdays.
And you work at the, and so, you know, only as needed. So you're talking about the transaction at the individual level there. But how are we going to learn what the right treatment is if we're not sharing information? I mean, I think the most remarkable story of our time with the disease is cystic fibrosis, where when the patients got together and the families and said, we're going to create a registry that has our data in it, and we're going to share it, because our doctors don't know what to do with us. Sure. They're guessing most of the time. And if we actually collect the information and share it, and we hold them accountable for learning from it, now we have a doubling of life expectancy in cystic fibrosis.
I don't disagree, and there's a difference, though, between actively sharing, opting in, and understanding that your information is contributing to something like that, and then data being flushed out the door without your knowledge, consent. And again, I think having a right framework, transparency around when you use an app, what's happening with that information, who's controlling it, where's it going, those are things that we need to put in place that they're safeguards. You know, patient privacy, you know, my father's identity was stolen last week. You know, new credit cards, call the banks, we'll get through it, but he can get a new Amex. I can't change his private genetic health data. If that gets stolen, if that's out there, that's unrecoverable. And once the genie's out of the bottle, you can't put it back in.
Heck, my identity was stolen when I was FDA commissioner. There were about a third of the federal workforce through the Office of Personnel Management in the federal government. So, you know, and we'll get to it, but you know, which is more important for most people's health, their genetic information or their financial and other behavior?
I mean, we know that social determinants drive a lot of health outcomes, and I'm not arguing with that point. Again, we just have to have a thoughtful framework for where that data is going, who's seeing it, how it's being used. There are numerous examples of bad actors in the tech space that have not always done the right thing when it comes to protecting confidential information. And again, I just don't think that this is a place where we can tread lightly without being thoughtful.
So I think we'll get back to this debate because I'm fascinated to watch it unfold. But maybe get back to kind of basics of just do you believe in this idea of the Techlash? Are you seeing it? And then in the work that you do every day, how much do you grapple with this particular topic?
I mean, you know, I don't think when the internet came into play that anyone could envision the degree to which it's affecting every aspect of our lives. And having effects that were unanticipated. So I think whether I'm at Duke University dealing with a health system or I'm at Verily dealing with a tech company per se, there are a set of issues that are unresolved that we need to deal with. And I don't feel bad about that. It's just things have moved fastly. But now we've got to work our way through it.
We're not in a place right now where technology in healthcare is routinely an asset versus a burden, and we need to flip that. And I mean, everybody in this room, I think, understands the pain points that the physician community, the provider community, healthcare systems experience when we think about the integration of technologies into workflows, usability challenges, the sad tale of the electronic health record and why it is frustrating for so many doctors, number one pain point. Yet, we believe that if you can get data portability, liquidity, we know that you get better outcomes when things are shared and transparent and not fragmented. And so that's the opportunity.
And how much do you play a role in calling out, various abuses that you see within the tech world?
Well, again, the AMA has its perspective in sort of representing the physician community around what we think is best practice for patients. What's challenging is you've got this sort of intersection between an evolving regulatory framework and then what's happening on the private sector, and we certainly want to make sure that the gaps in what's evolving are pointed out.
Going back to your original question, Chrissy, about do you grapple with the Techlash? I think that's part of the reason that why organizations like Google Cloud are even here is to build that bridge between tech companies and healthcare and life sciences as we see it today. And I do think that sometimes one is moving faster than the other, and so there's quite a bit of conversation that's to be had, right? To be able to meld some of the things that you're talking about to be meaningful and secure for patients.
All right, I want to move this to Tech 202 instead of Tech 101. Let's get to the higher level.
What is Tech 202?
Tech 202, part of it for me is, and since I've lived in the federal regulatory world, the clinical world, the academic health center world, and the tech world now, a simple way to say it, my grandfather was a Baptist minister, and he taught me we are all sinners. And so, there are definitely issues on the tech side, but also let's look at, is it a good thing that our best health systems are hoarding information and blocking sharing of data? I spent a lot of time in the Obama administration trying to get the data freed up, because if you got a rare disease in the US today, the only way to know what your best treatment is to share your data with other people with rare disease. And the people that are blocking that the most are actually the physician and health system community. So I don't think any of us are all good or all bad. So we got to sort of deal with all the sectors as we think about this.
I often, to your point, I often mention that sometimes I'm given my health information on CD-ROM.
Right.
And how do you even find a computer with a disk drive? That is true.
So literally that happened. I was in the operating room. It's 3 a.m. Somebody comes in. I'm taking call, and I get the DVD of their spine images, and there's no DVD in the operating room. So what am I supposed to do? It's completely useless to me. There's nothing more that I want than to be able to see what's happening to my patient as they float through various aspects of the healthcare system. We certainly believe that should be possible. We know technically it's possible, but there are barriers, and information blocking has been a huge issue. Certainly there is a federal effort to try to solve some of that started with the last administration, is moving forward. But the reality today is that it's sort of very, very hit and miss, as I think you're experiencing.
Yeah, and actually a question for you, which would be one of the coolest things that I saw your group do was an effort around trying to take facts and then just digitize facts. And I wanted to know the inside story of that. Like, were you guys sitting around one day being like, let's do AI and machine learning? And then someone was like, nope, we're still dealing with the fax machine.
It really is. Unfortunately, and as archaic as it may sound, that is really part of the challenge is part of the workflow of a physician's practice is really taking a look at how do we translate, not just the physician's practice, right? If you're talking about even in the life science companies, when you're looking at pre-authorizations, trying to understand how do you, and while The fax was, I think it was sensationalized to a degree because it just felt like something that you could pick up on, and there's probably there's much more meat to it, and it was just part of the step one, but it is really certainly was something that we decided to spend some time on because it really is part of a challenge in the workflow right now.
I'll tell you a funny story. So I spent 10 years in the Navy. I was in Afghanistan in 2014, 2015, and it was during the drawdown, so we're getting rid of all sorts of stuff. And one day my assignment was to take a truckload of unopened, brand new fax machines to the dump. And I said, why do we have like 30 brand new in-the-box fax machines in Afghanistan? Who would I fax from the hospital here? They said, well, you're a hospital. Of course you need fax machines.
So by standard, it was just assumed, right?
Right.
Yeah.
Right.
You'd be surprised at how many inquiries we received on that.
I actually did a story once about millennial doctors and medical students who didn't know how to use fax machines, who were deeply embarrassed to have to ask people on the staff, like, ooh, how do I use this? How do you know it got sent?
Yes. Yeah. I was deeply disturbed when I was prior to joining Google. I was at working in a prominent pharmaceutical company and understanding how some of their pre-authorizations work with direct-to-patient access and understanding and seeing the delays that can happen only purely because of the administrative burden of getting these faxes and having them translated into the individual file was just phenomenal in terms of just...
It's funny you're having this discussion. I mean, when I started out, we didn't know what caused heart attacks, and that's what really catapulted my career. As I started in coronary care units, we figured out it was blood clots, and then the race was on to develop effective treatments, but the internet for practical use didn't exist. This was 1980. So it was actually the advent of the fax machine in common use that enabled us to do global clinical trials in multiple countries at the same time. It was the only way to communicate. But the other amazing thing about that time, I'm sorry to reminisce here, but that was also when Tiananmen Square happened that year. And there was sort of a battle on the fax machine between EKGs from people being enrolled in clinical trials and messages from China. And so, you know, that's obviously like 2 log orders less than our ability to communicate now. And I think what we're talking about today is what are the rules? What should the social norms be and the regulations that move that in a good direction?
And we certainly want a rich ecosystem to emerge where information and services can be sharing data. But I don't think we can assume, frankly, that the market is going to self-monitor and get rid of all the bad behavior. And we've all experienced when a trusted brand misuses consumer data, and I wouldn't call anyone out, but we certainly...
Feel free to if you like.
No. But there are bad actors. You know, the Washington Post reported on a pregnancy tracking app that was sending data to employers that included the average time it took to get pregnant, if the pregnancy was high risk, and when they thought the employee would come back to work. Frightening. NPR did a story on insurers gathering data unknowingly from patient medical devices to make coverage decisions and rate determinations. A lot of those companies justify that behavior because it supports their bottom line and maybe customer trust isn't a priority, but we simply can't let the profit from data commoditization win out as a cost of the doing business.
Jesse, you're just drawing me out here. This is fun. So, but let's look at the other side of that coin. When I was FDA commissioner, I could not get our doctors in hospitals and academic centers to agree to enter the identifier for a device put in a human being as a standard of practice. And so we got all these people walking around with high-risk devices. No one knows. We know more about the tires on your car than we know about life-threatening conditions that may occur when a device goes bad. So there's we got to find the middle ground here. So it's not...
Reminds me of that Homeland episode, right?
Yeah,
With the pacemaker. Did you guys see that?
Yeah, no, I love it. My phone beeps if the tire pressure is low in my car. I get it, but we can empower access while promoting privacy and transparency. Yeah. It's not either or. We want both. And again, we just don't want to be in a situation where you have situations where data is going out without consumers, patients knowing, and one day America wakes up and suddenly they realize that their healthcare data doesn't belong to them anymore.
Well, but let's test the other boundary on that. So what about public health issues? So do you have a right to hide that you're not getting vaccinated from a condition that might infect other people.
I'm going to defer the vaccine question, am I right? Who wants to tweet?
So, there are many issues where optionality, so when you talk about control of data, I think we have to be careful to not imply that we're going to be in a country where you can't
share this information, right?
Yeah.
I don't disagree, but everybody, government body, company, device developer who wants to have that level of access needs to make that argument to the American public as to why.
And I think that's the conversation that has to be had. Sorry, Chrissy. The conversation that needs to be had is not about whether we can share this information. It's about creating more transparency around who's going to be getting what, and what are you going to be doing with that. What are the constraints around that, and what will you be doing with that information? And I think that's really where that question is coming from.
And I want to ask you a question from the audience, which is, who should own health information? It could be the physician by some argument. It could be the consumer. What about ownership versus access?
It's not who should. The law is clear on that. Your health information, when it comes to and I'm going to.
Although the law is kind of murky around
I don't
the
think it
ownership
is.
versus access question.
Well, no, I don't think it is anymore. So just a quick word on this. Again, we're only talking about what I would call traditional health information, your interactions with a healthcare system, which is, in many cases, is not the most important health information, but it is important. The law says it belongs to you, and it's illegal for an entity like what you described with the CD. There are fines for doing that now.
Unfortunately, I just tried to get some health information last week, and they told me they couldn't find it. It still happens. It's still commonplace.
But it's illegal.
I'm going to bring you with me.
The law is clear
next
about
time.
that. The law is very clear.
Make sure you take the right Robert Kid, if not the guy who stole his identity.
Next time it happens to you, feel free to send me a message, and we'll do it together.
We'll go together.
On Twitter.
Yeah.
On Twitter. Because if you're telling me that they can't find health information about you, what about your doctor who's maybe making a critical decision about you? If they can't find it for you, then that means they can't find it for your doctor.
Which is often the case. And maybe we could take a beat to talk about what's changing on that front, because every year this question of interoperability comes up. And there are certainly, proposed new regulations that make this topic more optimistic and exciting this year. But what is going to change for the actual patient? Because, it seems like things haven't significantly, at least since I've been, doing this work.
Yeah, I wish I had a great answer. There are a number of what we would describe as pre-competitive needs that need to be out in reality for that data to flow. So, we don't have data models that are coherent, and there's no semantic interoperability. And so there are lots of groups working on that. The AMA has something called the Integrated Health Model Initiative that is one approach to try to add some normalization across code sets. But those things are precursors to allowing then developers to move data around. Again, another piece that we need is a patient-centered privacy framework and transparency, so that when those things are happening, they happen in an appropriate way. I just don't want to be in a situation where companies feel that it's okay to sidestep privacy or even anti-discrimination laws, but there's the potential for that to happen.
Oh, here we go again. So let me just say, the law is clear. The law needs to be enforced. There are fines that have been defined if people don't allow you to have access to your data. While all these things need to be worked on, the fact is it is child's play to move health information from one place to another when it's in your interest. And what's called information blocking is happening because it's a financial advantage for health systems to keep other health systems from having your data. And that's got to be dealt with. I'm not trying to deflect from the fact there are major issues with tech companies too, but I just want to make the point that it's a multifaceted problem. We need to work on all of it at the same time.
And Shweta, too, you guys just signed a deal with Mayo. We had a question from the audience about that. How will that advance medical science, and is that going to change, the way that Google interacts with patient information? And will this mean more interoperability at Mayo for those patients?
Yeah, that's a good question. So yes, we did just recently announce that partnership. at the end of the day, it doesn't matter who we're partnering with. It could be Mayo or a community hospital. It really is that data still belongs and sits with the organization, right? We don't have access to that information. So to put that to rest to begin with, of course, a natural question that I would expect to hear, though. But what we're looking at with Mayo, right, is to advance their digital transformation, right, with a few tenants involving innovation and working with them. They are housing phenomenal amount of data and patient data. So how do you find these insights and work with them on that? So we're very, very proud for that partnership. But to answer, I think, the underlying question about how is this going to be, would we be having access to Mayo's data? We would not be having access, or we would not be touching that particular data.
The audience also wants to know your feelings on blockchain. I don't totally understand it, but just to put that out there.
I will probably say that I'm not the best person to be answering that as well on behalf of Google.
We will get into
I have some personal opinions, but we can maybe get into that a little bit later.
Yeah, I'm doing a masterclass this afternoon on AI in healthcare, and we will touch on blockchain. If anyone's interested, come by.
Very good.
If you can tell me what it is in a sentence, then that I understand.
Different framework for ensuring how data moves across. And there's some, I think, promising, interesting ways for using blockchain in healthcare data. I think some of the work in credentialing has some possibilities. The AMA has, through our innovation company in Silicon Valley, Health 2047, I know we have some of our team members here, a company that's spun out called Acuri that's looking at using blockchain technology for some of its work around creating data sharing networks to solve some of these interoperability problems to get around what's happening in the data blocking space.
So tech companies in general, it seems like for the most part, I've seen tackle a lot in the wellness area, and this may be because there is less regulation, but it's, you see that with fitness tracking, pregnancy tracking. These are all areas that VCs seem to like to fund. But someone made the point here, which is absolutely correct, that the social determinants of health, this actually does matter and it does move the needle. And are we going to see tech companies start to really take more of an interest in the things that really matter to the patient outside of kind of the step tracking and the heart rate and everything else?
I think understanding, to be able to understand a patient or an individual in its entirety, I think you're going to have to think about all the omics, right? And so they're going to be looking at not only just the step tracking, but trying to understand a little more of the behavioral aspect, and then combining that with information that they choose to share about their PHI. So certainly I think that there is going to be a new wave of understanding a patient when you're looking at them holistically, outside of just the steps and pregnancy tracking.
A lot of opportunity, but what I would say is that what we have too many of today are digital hammers looking for a nail, and problems that aren't informed by appropriate sort of clinician input at the beginning of the development phase. I get flooded with data from sort of these consumer devices. I don't know what to do with it right now. Maybe someday we'll know and it'll be helpful. But I think that there is a space that all of us could play in thinking about, as those technologies are brought forward, how we can strengthen trust that they work, that they're appropriate, and that they're helpful, particularly as we're thinking about data moving around, which is kind of the focus of the conversation today.
Yeah, so Verily exists almost totally in the regulated biomedical space. And let's just step back for a minute and just imagine you have a problem like diabetes and you're overweight. Can you imagine a dumber way to deal with that problem than saying, why don't you call and try to make an appointment with a doctor, and let's say you have Medicare, you may not be able to find one in your region who takes Medicare patients. Then you wait, and then finally your chance comes to go to the office. You sit in a waiting room for some period of time. You go in to see your doctor's typing into a computer, not looking at you, hands you prescriptions as you walk out the door 8 to 15 minutes later, and you're bewildered as you walk out, having no earthly idea what happened or what you should do next. And then you wait 3 months to come see a doctor again. If you wanted to go to a restaurant, you just say, here's the kind of food I like, show me the restaurant, and here's information about it. There's, so we got to find, again, it's all about the middle ground. I agree that flooding doctors with consumer information is really also dumb. But
How about nudges? Nudges.
nudges,
for the
and
patient?
we're living in a chronic disease world. That's the problem in economically developed countries right now. And we have an outmoded system of healthcare that needs to move. So you get most of your information at home, and you make decisions interacting like you do every other part of your life. And then the doctors and nurses can do the parts that they do really well. That's the hope.
I wouldn't disagree with that. Another company that spun out of Health 2047 is First Mile Care, chronic disease management. It's doing, the Uberization of coaching on demand for prediabetes patients. But the insight that's made that work so successful is that the initial communication to get into the program is coming from the doctor. And we know that when you have physicians, making those connections, that you have much, much higher, 100-fold higher uptake of these kinds of platforms and tools and technologies than, if Aetna's not in the room, right? Aetna sends you a letter in the mail, to go do this thing.
I agree with that. We also got to be real in this country. I mean, I'm a doctor, so I wish that everyone had a doctor. But it turns out if you go to a Walmart in rural America and ask the question, who is your doctor? I won't give the exact number, but it's a lot of people actually don't have one, and they can't get one. And so, we're going to have to digitally enable a workforce which is non-physician to do a lot of this work. I mean, the idea that if you live in parts of America, you got to drive 2 hours to see an endocrinologist for your diabetes, it's just not, we got to find that middle ground.
But is tech even reaching, those people? I mean, it seems like we've seen study after study showing that, it's a lot of penetration right now into the healthy, wealthy urban professional that has no problem finding a doctor.
The worried well.
Yes. And perhaps we are moving beyond that. I mean, I think Rock Health would say we are.
Yep.
But, what evidence are you guys seeing that technology can actually have an impact in those populations that really need it?
I think we are. I live in Wisconsin, Milwaukee. I do a lot of work in rural communities, and telehealth and telemedicine is critical when you think about how can you expand access and reach people that live 4 hours, not just 2 hours from the nearest doctor. We have counties in Wisconsin where there are no psychiatrists. So how do you get access to behavioral health services? How can you scale? Again, that's the promise of technology. The AMA thinks a lot about what are the payment systems? How do you have codes? How do you support adoption and remove barriers for these things to get covered, paid, and then access at scale? We're not there. We're starting to see, I think, promising little tidbits, but certainly there have to be partnerships between physicians, care systems, and tech developers to make those things a reality.
It sounds like I'm attacking Jesse, but he's actually doing it. So I give him a lot of credit for that. And I would just say this is an enormous challenge. If you look at the latest data from the US, people like us look like Scandinavia. We're living almost forever, and our quality of life is getting better. We're more functional. If you look at the gradient of education and wealth and physical location, there's a big part of America which is seeing a very substantial decline. The biggest deterioration is in white men who live between Oklahoma and West Virginia, for example. So we've got to figure out how to reach people who have been marginalized in this tech-savvy world. It's a big challenge.
What we don't want are technologies that worsen that digital divide,
Right.
exacerbate those disparities, and God forbid, AI tools that are developed that introduce more bias in the system. And there are risks of that. Again, come to the masterclass, we'll talk about it.
What we're seeing, and I think this is a little contradictory to maybe, Jesse, what you were saying earlier, but for telehealth to really be successful, you really need to be able to see and create these forms of being able to share patient data. And coming back to some of the earlier points, it's not about can we or should we, it's what are you going to do with all this information, whether it's patient data, whether it's consumer data, whether, what it might be. It's very interesting because I think we're at a time where you have this abundance of information and you're trying to figure out what you're going to do with it. And so sometimes it's easier, at least I can say this from an outside perspective, it's easier to say, no, we don't want this information because you don't know how you're supposed to react to it. And I'd love to see next year, maybe, I don't know if we're allowed to do this, but next year a talk on, what's the path forward in being able to talk through all these different types of data, right? What is the AMA thinking about? What are other organizations thinking about, right?
A related huge challenge, and I had a really insightful discussion with a group of people yesterday about this. If you think about your own family, most of the tech world was built on an individual interacting with technology. Most of us, if we get sick or really have a health problem, there's a community of people around us. For men, it's typically the wife or the spouse. And so we got to build a system of tech, and I think people should have doctors. I think doctors should do different things than what they currently do, and a lot of it would be helping people interpret information, which can be very frightening and threatening. If you learn you've got a diagnosis, it's hard to think straight for most people. So we've got to build connections in a social network that's supportive.
And that's where I think technology, again, can be an asset to letting physicians be more effective, do different kinds of work. It's crazy that I'm sitting there typing away, all day long when the data should just flow in and be there, and then I can sit and have that conversation. Again, when you have to have a difficult conversation with a patient, God forbid you have a difficult diagnosis, cancer, whatever, those are the places where I think we bring real value and where you have to have that human-to-human interaction. The tech should support it.
So back to the topic of the Techlash, one thing I've noticed just being a reporter in this space is that I tend to do a lot of sleuthing. And that is because many of the tech companies that I cover are not super transparent all the time about the things they're working on. And for them, they would say, oh, it's IP, this is protected information because it's our ideas. But oftentimes, the consumer only finds out, quite late into the process, and it can sometimes take years for the consumer to formally learn that a giant tech company is even in healthcare at all. So do you think that tech companies need to be treating health differently than they do any other sector that they're in, because there is so much of health that is so sensitive to people and so personal, and so much of the space is very transparent, I think, by comparison?
Short answer is yes. Yeah. I'd say in Google, that was the reason that Google Health was formed. It's a relatively recent development, and the person in charge of it is David Feinberg. No, I know he wouldn't take this wrong, but he's not a technical expert. He's a child psychiatrist, which may tell you something about the skills that are needed. But the real issue there is, it was a feeling that within the Google universe there needed to be a concentration of effort to solve some of these problems, and in a very public way those announcements were made.
But I think to be successful, tech has to figure out how do we strengthen and cultivate consumer trust. And right now I think there's a hesitancy and a gap, and I think there are regulatory pieces that can be helpful, and then I think that there are also approaches that companies need to think through about how can they create those relationships and partnerships where there is transparency and people understand what's happening and are willing to share information and allow it to flow across.
I think actually, the perspective is that these tech companies are transparent, but as they are entering and have entered healthcare, I think the same transparency that may have worked in other industries is not translating the same in healthcare. And so looking at trying to, I think Google Health is a great example, garnering and bringing in, I think what I've seen Google done a lot in the last couple of years is bring in a lot of industry experts into the organization. Because I think that if tech companies are going to be successful in partnering in this space, it is going to be by bringing in the industry experts who can help guide those conversations and advise how we can continue to be transparent in this space.
Great, cheap, easy way to do that. On the AMA side, we created something called the Physician Innovation Network. It's free, go online. We've got 10,000 users. It's a place for entrepreneurs, developers to connect with clinicians and physicians and experts so they can have those conversations. And we do a lot of chats and facilitated conversations because we really want those partnerships to happen organically.
So I'm going to put you guys on the spot. I did a little poll today on my Twitter feed, which looked at which of the tech companies do you trust most with your health information? And the options were Apple, Google, Microsoft, and Facebook. Facebook, 2%. Microsoft, 22%, not bad. Google hovering around 9%, and Apple at 67%. So what is Apple doing right and Facebook doing wrong?
Well, I
It's
would
about
say-
perception, right? I think the first part of it is, the perception that Apple has created. I don't think the articles about Facebook helps that situation. But I think what Apple has done right has really been being as open as possible about what they're doing. Once they had released Health Kit, Research Kit, all of this. This was, while maybe not easy to understand, they had put it all out there.
I'd say Apple's declared itself to be in a different business. I mean, it's dealing with health information, but it's not proposing to interpret information to give people more information. It's a conduit, and it's an amazingly good conduit. I have an iPhone and use it all the time, so I don't have any problem with that. But when you get into the business of you really are providing interpretive information for people, you can't do that. There has to be a connection to people, and that gets into much more difficult territory. And what I'll tell you is that in the work we're doing at Verily with things like the baseline study, when we engage people and their clinicians together, almost everybody's willing to share information, but they understand what it's being shared for. So it's how we do it that's going to matter.
I don't have a comment on any specific company. I've been told not to, but I will say, look, doctors take confidentiality very seriously, and that's why preserving trust in our digital world is critical. And how we get there, again, I've got lots of thoughts. We've talked about some of those things today. I do hope that all of you in this audience who are developers do take a minute to step back and think about what are you doing to advance that part of your development cycle.
All right, we've got time for one last question. So this is one from the audience that I think is really interesting. So who is going to profit at a time when consumers are increasingly sharing their data with companies? What happens if I share my data in a trial and that then gets turned into some kind of great breakthrough by a pharma company? Who could the consumer profit? Should the patient profit from the fact that they chose to share their information?
They certainly could. There are frameworks and companies that are sort of trying to sort of have the patient have some skin in the game and be incentivized in ways. I think that's an interesting novel approach. Whether that is successful or not, I don't know. Look, if patients want to share their data in that way and they choose to be compensated, I don't have a problem with that as long as they understand what they're getting themselves into.
Yeah, I mean, those frameworks are being worked on, and I think most people are going to be disappointed because the value of your data is only valuable if it's in conjunction with a lot of other data. So you begin to work through the models, and I think people are going to be disappointed with how the individual's data comes out in that scenario. Yet it's also true that if you don't combine data, then you know nothing, and things like new treatments don't get developed. Mm-hmm. So there's going to be a really interesting set of discussions over the next decade about that.
I think I don't disagree with either of these two comments. From my perspective, I think that I think individuals may be sorely disappointed because the amount of effort, not just the amount of data that's required, but the amount of effort and investment that goes into making a breakthrough, I think is underestimated. And so there may not be a big pot of gold at the end of that rainbow, right? So from my perspective, I think that I have seen both frameworks kind of work out, and even, this is not new, right? People have been being compensated for participating in different trials, and they're not getting it when the big breakthrough happens. They're getting it even up front, right? So
So don't expect to get rich
No,
by sharing your
that is
information.
correct.
All good as long as there are meaningful controls and patients have an understanding of what's going on. And that today we just don't have.
Well, thank you. We're out of time.
Yeah.
And appreciate all the questions. You guys are awesome. Thank you so much.